I'm Dr. Clare Relton. I was a homeopath for 15 years. I got involved in research in various ways, but ended up doing a Master's in Health Services Research at the University of Sheffield in a place called SHAR, the Sheffield School for Health and Related Research, and then went on to do a PhD in clinical trial design. And this was facilitated by the lovely UK Department of Health, who gave me a full postdoctoral, a full pre-doctoral training fellowship. So it meant they paid me to do my Master's and PhD, which was fab. And then since then, so I qualified in 2009, I got my PhD in 2009, and then since then I've been working as a researcher. Initially I did some work at the University of Leeds, and then I came back to the University of Sheffield, and I now work there full-time in SHAR in the University of Sheffield, and I'm in the public health section, which is very interesting, very interesting. I remember first thinking about homeopathy and research, so combining those two terms in my head, while listening to Rebecca Preston teaching me in the third year at the Northwest College of Homeopathy about belladonna, and her citing the fact that the belladonna was proved on 5 people. And I remember falling off my chair at the back of the class at the idea of this homeopathic remedy, which had been used for 200 years, 300 countries, and it had been proved on 5 people. So I thought, well, what is the evidence base for this very interesting system of medicine? So that's got my mind going. And then when I started having to work in the NHS, when I started working in the NHS, I had to collect routine outcome measures, routine outcomes on every patient for every consultation. So I used MyMop, which a lot of you will have heard out. It's a patient-generated outcome measure, validated outcome measure. And then we found I just found that whole process which was very interesting. I was then also a homeopath inside a trial. I was a homeopath, one of 10 homeopaths in Elaine Weatherly-Jones's chronic fatigue trial of homeopathy, and I found the whole experience very interesting, disturbing even, and I thought, well, what is this? I don't understand. If this is science, I don't know what it's measuring. And that set me up with a whole load of questions. So that was 10 years ago, and so I think the last 10 years has me been trying to answer those questions that came up for me within the trial, and I feel like I've addressed a few of them. Still a lot more to go.